Thank you for joining for our COVID-19 briefing today, where we provide information to Tennesseans about how it is that we are working to mitigate the spread of this virus and how it is that we are working to begin to open our economy back up in the state. As many begin to return to work this week, I will begin to spend more time outside of the Capitol. I'll be visiting small businesses and nonprofits and healthcare providers across the state. And while our scheduled briefings here will no longer be held every day, I look forward to spending time on the ground with Tennesseans in communities all across the state. This Friday, Maria and I will start by going to Second Harvest Food Bank and packing boxes of food for those who, in particular, have struggled through this pandemic. Natural disasters like tornadoes and COVID-19 have created a tremendous hardship for a lot of Tennesseans. And I encourage you to volunteer, to donate to food banks, to nonprofits, to churches, to those that are serving Tennesseans all across the state as we work together to help one another through this crisis. While the pandemic has certainly created turmoil, it's really been an opportunity for us to see how Tennesseans can come together, private citizens, the public entities, private sector organizations. And today I want to give a special thank you to our banks, our financial institutions all across this state. They're located in every town, in every region of Tennessee, and they have been great partners with us and with the federal government. They have been responsible for assisting more than 75,000 small businesses as they have pursued and received $8.95 billion in Paycheck Protection Program loans. Our banks, our small town banks, our big banks, our financial institutions all across the state have been a great partner in getting assistance to those businesses that are most in need as a result of the COVID-19 pandemic. Over the last 3 weekends, we've tested more than 23,000 Tennesseans through our drive-through pop-up testing centers all across the state. But we want to remind everyone that not only is testing available when we have drive-in pop-up centers like that, but testing is available 5 days a week, free COVID testing for any Tennessean in any health department in any county in Tennessee. And we want to encourage you to go out and get a test. Remember, when in doubt, get a test. We need Tennesseans to be tested so that we can have a greater understanding of how this virus continues to move through our state. Today, we have 13,624 confirmed cases of COVID-19 in Tennessee. 6,356 of these Tennesseans have recovered. That case count is up by 122 over yesterday. We did 7,353 tests over that 24-hour period of time, as reported, and we have tested 219,000 Tennesseans. Today, I want to preview forthcoming guidance from our Economic Recovery Group. I want to talk a little bit about our efforts to secure personal protective equipment for all Tennesseans. I want to talk about how we're getting thermometers available to businesses that are making an effort to open safely. Talk about the return of dental procedures in our state and some newly awarded rural hospital grants that have been distributed this week. Our Economic Recovery Group will be issuing guidance tomorrow for small group recreation outfits like bowling alleys and putt-putt golf businesses. Small group recreation businesses will be allowed to reopen on Friday, May the 8th. Tomorrow, we will also be issuing guidance for several other industries, those businesses that have remained open through this pandemic but that need additional information and tools in order to operate more safely. Guidance for offices, for manufacturing, for construction, and a number of other types of businesses. As these companies prepare to implement guidelines for safer operation, many of them will be utilizing thermometers and have a need for thermometers to take temperature checks of folks coming into their buildings. Our Economic Recovery Group has secured a special pricing on touchless thermometers for those businesses that will be using those thermometers, and they can go on TennesseeTNPledge.com today, starting today. Tennessee business owners will have the ability to order through Friday at 4 p.m. or until the supplies run out. They're limited to 10 per business at TNPledge.com. And as we all begin to use cloth masks in a greater way whenever out in public, our Unified Command Group has forged a partnership with Renfro Corporation, which is a global company that has operations in Cleveland, Tennessee, to secure more than 5 million cloth masks and to begin this week that distribution in Tennessee. Our first distribution has already gone out to all 95 health departments in the state of Tennessee. Any Tennessean can receive those masks free of charge at your local health department. The Unified Command Group has also secured a partnership with a company called Battelle. It's a global research and development company that sterilizes N95 respirators, which is a very important piece of personal protective equipment, particularly as we begin again medical procedures and dental procedures. The use of N95s is critical. This technology allows the reuse of N95s through sterilization, and Battelle has created this technology to help keep our healthcare workers safe. We continue to be grateful for and thank those on the front lines, those who are providing healthcare services to all Tennesseans. We want to make certain that they have the personal protective equipment necessary to keep them safe as they serve Tennesseans. This technology for sterilizing N95s is available. It will be located in Jackson, Tennessee, and will be allowed to sterilize up to 80,000 N95 respirators every day. We have been working with the Tennessee Board of Dentistry, and working with them, dentists will be allowed to begin practicing again tomorrow. The Board of Dentistry has opted to use the American Dental Association guidelines, and we support them in this process and dentists all across the state as they serve their customers in a safe way and have that opportunity to begin that tomorrow. We all know that COVID-19 has placed a considerable strain on our small hospitals, our rural health providers across the state, and we want to make sure that those facilities can continue to operate and stay open. In April, we announced $10 million in grants to help keep small and rural hospitals open and to offer services and financial grants to them to bridge the gap between the struggles that they were facing financially and the federal funding that's coming through the CARES Act. The following hospitals have been added to the list to receive funds. We previously announced a group of hospitals that had received grants through this $10 million grant program, but these hospitals have now been added to the list that will receive funding. Macon County Hospital, Ray County, Murray Regional, Henry County Medical Center, and Houston County Community Hospital. We continue to and want and will continue to support our rural and small hospitals as they serve Tennesseans in every corner of the state. Dr. Piercy, would you please come up and give our health numbers?
Thank you, sir. Good afternoon. Our case count today is 13,624. That's a less than 1% increase over yesterday's number. I will caution you, that is only one day. Just like we don't get too upset when the number is big for one day, we don't get too excited when the number is small for one day. I'll put that into context for you in just a minute. We have had 226 unfortunate deaths, and I do have an update on that, and 1,156 hospitalizations. 6,356 Tennesseans have recovered. Speaking of numbers, I want to remind you that this week is when we are testing all inmates and staff in state prisons. That started yesterday and is going on today, expected to be complete over the weekend, perhaps into the first couple of days of next week. The reason that that's important is because when we started testing yesterday and today, those results are going to start coming in probably tomorrow or Thursday. We expect our case numbers to go up because of that. That doesn't cause us alarm, but we just have to keep it in context that we do expect to see increased numbers then. And that's because we're testing a targeted and high-yield population. If you don't look for something, you're not going to find it. And that's what we're doing. We're going out and looking for it so we can identify the cases to not only treat those patients earlier and have better outcomes, but to also protect the negative patients and the negative inmates so we can protect them from getting infected. So far, we have had just shy of about 2,000 prison inmates and staff test positive. The good news is that about 98% of them are completely asymptomatic. They're well, they feel good, and we've talked before that is a bit unusual, but it's a phenomenon we're seeing all over the nation. Unfortunately, 6 inmates have been hospitalized, 1 is in serious condition, and unfortunately we had an inmate from Trousdale pass away early yesterday morning. He was a 67-year-old male with underlying health conditions, and our deepest condolences go to the family. Finally, we did talk last week about having all long-term care facilities in the state do testing in the month of May. We encourage everybody to reach out and go ahead and get that started. We published guidance on Friday through letter, and we also posted an FAQ, or frequently asked questions document, on our website that has some answers to common questions as well as contact information to learn more. That can be found on our Congregate Care webpage of the Department of Health website. Thank you. I'll stand by for questions.
Thank you, Dr. Piercy. I just want to again say thank you to Tennesseans for your efforts. They are paying off, and they must continue as we begin to move into this next phase of reopening businesses and folks moving about a little bit more. Social distancing works, and it's more important now than ever as Tennesseans open their businesses safely, take this Tennessee pledge, and if Tennesseans will continue to practice their social distancing habits and measures, then we can continue to move forward in the ways that we attack COVID-19 and to control the spread of this virus through our state. So thank you, Tennesseans. Take hope. We are making great progress. We are very encouraged about the direction we're headed, but we cannot let up. We have to continue to be vigilant and to continue those things which have gotten us to the place where we are today. I'll be happy to answer questions, open up the lines for any questions. I have members of Unified Command Group here. Of course, Dr. Piercy here with Department of Health, and we're available for your questions.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor.
Kim.
My question isn't necessarily COVID-19 related, but last night, a national judge decided that the ESA law was unconstitutional and unenforceable. I was hoping to get some insight from your administration on what that has meant for the application process, the ESA program.
Well, we are first and foremost committed to a quality education for every single Tennessee, and that's what the Education Savings Program is about, is to provide for low-income students in districts with lowest performing schools to have access to the same quality education that other Tennessee students have access to. And that's what this plan is about. We disagree with that court ruling, and we will appeal that, of course, and hope to move forward with the Education Savings Account program.
Right, but at this point, are you still encouraging parents to apply to the program?
We are. We're still encouraging parents to apply to the program because we believe that it will continue to move forward. So yes, we are.
Thank you.
Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Hello, Governor.
Hey, Natalie.
Given the drastic cuts that have already been made and will have to be made again to the budget, is it right to keep that $38 million in the budget for a program that has now been declared unconstitutional and that, of course, has the potential for a prolonged court battle? So is it warranted to begin the ESA program this year under these circumstances?
Well, I think anything that is going to allow children in this state to have a high-quality education is worth fighting for. It's worth pursuing. I believe very strongly in those children. I believe very strongly in the principle that they deserve, regardless of what zip code they live in or what their economic status is, that they deserve to have a high-quality education as well. So we'll continue to pursue that and believe that now more than ever, a high-quality education starting this next year is important for Tennessee students. They will have had a very challenging educational end of the year this year, and if ever we need to be investing in education for kids, now's the time.
Some of the other major education initiatives you and your administration had introduced this year, the Mental Health Trust Fund, literacy program, those are likely to be cut. Mental health program, I know, has been cut from the budget. I think the Future of Literacy initiative is uncertain due to the required cuts. Why is the ESA program more important than some of these other education programs that would affect students all across the state?
I think we'll be looking at educational initiatives and funding for education and continued strong funding for education in the future. The legislature, of course, will determine what the agenda is going to be, what you mentioned, literacy, other educational initiatives. Those will be determined by the legislature. And spending for education will be important as we consider just how it is that we manage this budget going forward. So I think there are a number of educational initiatives that we will continue to consider because, as I said before, now more than ever, we need to be investing in our children.
Governor.
Thank you.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. My question, I think, is for Commissioner Piercy. Commissioner, last week you expressed surprise that there were so many inmates who were asymptomatic, calling it a, quote, real head scratcher. Yet in late March, you notified long-term care facilities that there was a real concern with asymptomatic residents. Why does it say that you were so surprised about asymptomatic spread among inmates?
Yeah, that's actually a really good question. Elderly folks oftentimes have weaker immune systems, and it takes longer sometimes for them to show signs of illness, particularly this one. And so it's fairly well documented, not only for this infectious disease, but others, that they can have a longer pre-symptomatic or asymptomatic period. Now, I will clarify that elderly people are more likely to become symptomatic. It just takes longer, and that's a bit different than being asymptomatic. The thing that's still a head scratcher is why ostensibly younger and healthier inmate populations have such an incredibly high asymptomatic rate. And we're starting to see this all over the nation. Starting to see it not only in inmate populations, but in also in other very condensed, contained populations, even employer situations where people are very close to one another. So it's good that they're asymptomatic. It's just difficult to explain physiologically why younger, healthier people would have that type of asymptomatic behavior.
Do you accept any responsibility for the fact that this situation got so out of control inside the prison system?
Oh, I'm not sure anybody did anything wrong there. In fact, I think we are on the forefront of testing proactively. You know, when I hear this scenario played out all over the nation, I think you've probably heard me say I talk to my counterparts, at least in the South, every Monday morning, and without fail, every single one of my counterparts has had this on some magnitude in their state. And so, you know, the good news is these folks are well, and we're identifying them early. I think the thing that makes us a little bit further ahead in Tennessee than in many other states is that we're actually going out and proactively looking for these. Most states are testing just the symptomatic folks and their contacts, but when we did that, we started to see this growing number. So I'm proud that we've taken the proactive step of testing the entire inmate population, because that's not only going to help us treat the positive ones sooner, if they become ill, it's going to help us protect the negative ones from becoming sick.
and I have a very quick question on one other issue, Commissioner. On April 22nd, you said that the public, or you told the public that any long-term care facility with 2 or more COVID cases must report those. But I checked your directive, and even one confirmed COVID case must be reported. Given how contagious this virus is, why can you not start listing the names of facilities that have even one case?
One case is not a cluster, so we're listing cluster cases. And so 2 is by definition a cluster, and so that's how we report that. Quite frankly, it's going to be pretty unusual just to have one. Typically, as we've just gotten through saying, in that congregate care type setting, the spread is usually pretty rapid. And so we're not listing the ones, but there's probably not going to be that many of those, unfortunately.
Thank you.
Next, we'll go to CB Cotton with WKRN. CB, your line is open.
Hi, good afternoon, Governor. Given the death over at Trousdale Turner, I wanted to ask if your office is giving any additional consideration to accelerated releases for inmates that have been paroled. Any type of release, early releases to just decrease our state's prison population.
Yeah, so this pandemic and our treatment of, and our testing of and subsequent treatment of inmates does not include any change to release for any of the inmates or shortening of any of those sentences.
Okay, follow-up question. I know that there have been attorneys in the state that have been communicating with the Board of Parole about some early releases. Are you in contact with the Board of Parole about those requests that they are getting?
Well, the Board of Parole certainly is connected to our office. It's a part of state government, and but I haven't been requested by the Board of Parole to authorize any earlier releases or any shortening of sentences.
Maybe this is a good follow-up for Dr. Piercy. So, you know, some people have said that social distancing is tough given the prison environment. Dr. Piercy, in addition to testing, what would you say are some other means that can help mitigate the virus's spread within the prison population?
Yeah, you're exactly right. It is incredibly difficult to have social distancing when you're in any kind of congregate care setting, whether that be a prison or a group home or a nursing home. But there are a lot of steps that our prisons have taken and other facilities have taken to mitigate this spread. Mask availability, increase soap and hand washing availability, decreasing the number of times that inmates in this situation congregate with one another in recreational or group food settings. Some of that can be avoided, some of it can't. The most important infection control principle, whether it's in this setting or in others, is to actually cohort the well patients away from the sick patients. And that way they can interact with one another. And although it seems a little odd, it's okay for the sick ones to, or the positive ones, to interact with one another because they're all already positive. And so different changes in meals and schedules. And then another big one is visitor policies and screenings when they come in. So there's a really long list of mitigation efforts that these facilities can make to really reduce the spread.
Okay, thank you.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your line is open.
This question might be more for Dr. Piercy. I know last week we had talked about reporting the numbers of nursing home cases and updating that every day. Is that something that is going to happen this week, updating those numbers every day?
Yes, so after your question last week, I went back and talked to my team, and you know, the numbers just don't change much day to day, and so we're going to keep that on a weekly reporting basis because, quite frankly, we're all stretched pretty thin right now, and the same folks that are doing the counting and reporting are the same ones that are actually in the facilities doing the hard work and the heavy lifting. And I think you would agree, we would all rather them be on site and doing the actual work than updating numbers every day. So if the numbers change substantially every day, I think it would add value, but they don't, so we're going to report them once a week.
And is there an update on the testing of long-term care facilities? I know they were supposed to start some last week. Where does that stand now?
Yeah, that's what I mentioned earlier in my comments, that is starting, and long-term care facilities, by and large, have been very responsive to the call that we put out last week. They got guidance on Friday in the form of a letter, and then we posted a frequently asked question document on our website on the congregate care webpage, and it goes through lots of different questions that facilities had, as well as contact information. We have a point person that can facilitate that. Most facilities are ready and willing and doing it on their own. Some of them are going to need some help from the department, and we stand ready to help them with that.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
All right. I've got two questions. One relates to contact tracing. How many contact tracers does the state have at this point? And is that enough?
Yeah, that's something that we ask ourselves every day. And we started out with about plus or minus 70, and that might surprise you. You might not think that we would have contact tracers outside of this, but we do tracing on a lot of different infectious diseases all year round. That's kind of a full-time public health job. So we had plus or minus 70 to begin with. Then we took some other staff within the department that sort of multi-purpose or multidisciplinary staff, brought them on board, and then about a week, perhaps almost 2 weeks ago now, we brought on an additional 230 state employees that were outside of the Department of Health that volunteered to be temporarily reassigned. So now we're well above 300 contact tracers and looking to bring on another cohort probably sometime in June. As our case numbers grow, our need for contact tracers will grow, and so we're pursuing a couple of different avenues to meet that next cohort.
How many ideally do you need to do the job?
That's based on how many cases we have. And so I'll remind you that the Department of Health is in 89 rural counties, and I haven't looked at the breakdown in the last day or two, but the last time I looked, the 89 rural counties only accounted for about half of the cases, and so that's the number we're targeting. The metro areas have their own contact tracers. We're in frequent contact with them to make sure that they have their needs met and working with them to potentially supplement their needs, because we know that most of the cases are in the metro areas just because that's where the population is. And so making sure they have enough contact tracers for the metros as well as enough for us in the rural areas.
Thank you.
Next, we'll go to Sam Stocker with the Daily Memphian. Sam, your line is open.
Yes, Governor. I know Shelby County Mayor Lee Harris has said the state should give local governments more control during the pandemic in regard to paid sick leave for employees, the reopening process for businesses, since I guess he feels like he sort of stepped on the toes of Chattanooga leaders, and also the ability to regulate nursing homes more closely since they fall under state authority. Why is the state holding up local governments in these areas instead of relinquishing a little bit more control that he's talking about?
Yeah, so we are working together with local governments. That's how we do it. We have a daily call. Our office has a daily call with the city mayors of those major metropolitan areas as well as the county mayors to talk about the things that we're doing, the things that they're doing to make an effort to work together. Whenever there's a challenge, they have a particular need they believe that should be met. We talk about those needs and try to come to an agreement on where we're going forward. That's how we've done in reopening. We have worked together to create reopening plans that have moved forward pretty seamlessly. We're very encouraged by the way those teams have worked together. So that's our strategy, Sam, is to work together and work with, and we will work with Mayor Harris in the challenges that his county faces that he believes we can be of assistance with.
So have you offered to give them more control over nursing homes?
No, we think the way the nursing homes are overseen by the state is the best way to do it. We have the resources in place, we have the testing strategy in place, we have the oversight in place, and it's working well. We want to continue for it to be seamless and to be continuous across all 95 counties, so that's the direction we're headed.
Okay.
Thank you.
That's all the time we have today, Governor, if you'd like to make a closing
Thank you.
statement.
Thank you for listening. Thank you for the questions. Thank you for giving us the opportunity to give you an update. Thank you again, Tennesseans, for what you're doing. Be encouraged, have heart, take heart, have a great deal of hope, because I certainly do, about where our state is headed and where our outcomes are headed, and that we have a great crisis ahead of us. We have great challenges ahead of us. We have great responsibility, every single one of us, personal responsibility ahead of us that we have to stay committed to. But Tennesseans have done that so far. I believe they'll continue to do it, and we'll continue to make progress. Do your part and stay apart. Thank you.